Discussion on Senate File 4334, Senator Benson.
Thank you, Mr. President and members. I am grateful to bring before this body emergency funding in response to the COVID outbreak that Minnesota is facing and anticipating. This outbreak is creating anxiety for Minnesotans for many reasons, but it is stressing our healthcare system, and we are only at the beginning. We don't know when or how this will end, but we do know that we can do our part to support those who will be at the very heart of this. Last week, we sent $21 million to support the Minnesota Department of Health and their public health response. And they are doing all they can to prepare and to test and to advise as we attempt to flatten the peak. Walking alongside them, our nation-leading healthcare system, our hospitals are working together to prepare to care for patients, preparing for what we don't understand, but they are well qualified to care for us as they prepare. I have learned so much about our healthcare system, but every time they are faced with a challenge, I learn something more, and I am incredibly grateful for the work that our healthcare system, our hospitals, nursing homes, clinics, long-term care facilities, and the men and women who work in those facilities. Every day they get up ready to take care of us. We cannot do their work for them, but we can support them. And so we are here today with specific money, $50 million to start, rapidly moving grants to help them with items related to flattening the curve and immediate patient care, and another $150 million to eligible entities, again, to support them as they move through this unknown. So, members, I give you Senate File 4334. We begin with an oversight group made of hospitals, ambulance services, emergency management, and public health agencies. They will help MDH know where hotspots are emerging and where the resources are most needed. The Minnesota Department of Health will then allocate funds to hospitals, nursing facilities, settings with assisted living, healthcare systems, as they plan on an emergency basis for COVID response. They can be used for the establishment of temporary sites to isolate or quarantine individuals, temporary conversion of space for another purpose that will eventually revert to its original use. So think, for example, of a space in a hospital that is not currently used as an isolation space, but that would be converted and then would revert back. That is what we mean under that space, under item number 2. Staffing and overtime, we know that they are going to need more staff and that some of their staff will in fact be impacted. Staff training, orientation, purchase of consumable protective equipment for staff, visitors, and patients, development and implementation of screening. We are very fortunate to have screening and testing being developed right here in Minnesota so that we can catch up. We were a little behind the curve, but we're going to have to keep working to catch up. Patient outreach, emergency transportation of patients. Members, there may come a point when patients need to be moved from one facility to another, and when you have an infectious disease, that transport looks a little different than a regular transport. Information technology, supportive telemedicine. One of our facilities in 48 hours did more telemed than they did in the previous year. So Minnesotans are catching on with our social distancing. Accessing medical care via telemed is a wise choice. And then, members, we see that this is only for the COVID response under Section 3. Under this section, we're familiar with it. It's where we put the response for the public health labs. In this case, we waived the LAC review because we are so proximate to it's being used. As we move on to Article 2, the Healthcare Response Fund, this is $150 million. The same eligible providers and the same types of things the grants can be used for. We do have a legislative advisory commission review for grants, for expenditures that exceed $1 million. The commission has 2 days to review it, and they have to have a majority on both sides to stop it. Its default is that it would pass. But members, if we see something that we don't agree with or we don't think is in the intent of the law, we can work together to stop it. The grants need to consider needs across the system based on the different regions we have around our state. And again, that advisory board is going to be critical to seeing where an outbreak is occurring, where we might need more resources. They have to consider if the provider has other resources, reimbursements that they can use in place of state dollars, and whether that provider does have a lack of access to funds to properly respond. The applicant has to share some financial information. That information is private. The allowable uses of funds, members, we covered in the first article of the bill, same uses, same purposes. And then finally, members, there is in subdivision 7, a temporary health care site. If for some reason a provider is not reasonably capable of establishing and opening a temporary site, if their system is overwhelmed, the Minnesota Department of Health can work with their local government to establish a place where patients could be cared for, where they could be treated. It would be extraordinary to have that in Minnesota, and I wanted to call your attention to it. As a condition of accepting these grants, the eligible provider cannot bill uninsured patients. The eligible provider, if they are out of the patient's network, must accept the median network rate and agree not to balance bill that individual. If the funds are used for unauthorized purchases, the commissioner may call them back, and they must seek assistance from other sources. And if they do, and those funds exceed what the state expended, then they need to give some of the money back, the commissioner, and that will revert to the general fund. There is an evaluation that will come to us in January. The transfer, you'll note, any unobligated, unexpended amount shall transfer to the general fund. So members, if we get federal dollars in that exceed the need that we have, this fund might end up with money back in it, and we will have that back in the general fund next February. In Article 3, remember I mentioned the use of telemedicine as one of the things Minnesotans are starting to do? Well, we make sure that if you are at home and you engage in a telemedicine visit, it counts as a point of origin. Right now, it's clinics or a facility, and so we want to make sure that if you are at home and you're accessing your care from your home, as we would encourage you to do, that is reimbursable under various types of coverage. And so members, with that, I am grateful for the opportunity to have carried this bill, and I'd be happy to answer your questions.
Discussion on Senate File 4334. Senator Herr.
Thank you, Mrs. President. I rise to commend the authors and the body of the Senate for bringing this bill forward with urgency. As a senator that represents a district with disparities and high percent of low income and metro transit dependence and non-English speaking with cultural barriers, I want to know if this bill or this contingency account will provide resource to streamline communication to these communities, as well as having intake lines in other language for their information. And Mr. President, I would like to see if Senator Benson will yield.
Senator Benson will yield. Senator Herr.
Senator Benson, I'm not going to attempt to amend to this bill, but I'm just want to ask if this bill has the flexibility in its account to fund communication to communities that I have just mentioned.
Senator Benson.
Thank you, Mr. President. Thank you, Senator Herr. I would put that under the 7th point of the options, patient outreach activities. Those would have to, of course, be suitable for the culture that they were trying to outreach to, the population they were trying to reach. I know Senator Hayden had raised a question about the Somali population. I think if you're trying to reach them to help flatten the curve, that you would make sure that it was appropriate and welcoming so that you could be successful in helping them engage in this public health effort.
Senator Herr.
Mr. President, Senator Benson, will you yield for another follow-up question?
Senator Benson will yield. Senator Herr.
Senator Benson, will you continue to work or work directly with senators from both parties in communicating the needs for multicultural outreach or intake information from community with language barriers, relay those information to the agency and to the healthcare facility that should be working with people? Would you be open to that leadership or leading that role as an ongoing process?
Senator Benson.
Thank you, Mr. President. And Senator Herr, if you would help me to do that, I am happy to participate. I think you would be more effective in leading me there, and I will be happy to support where you're going. So thank you.
Senator Herr.
Thank you, Mr. President. Thank you very much, Senator Benson, for your response. And as each of us as a senator, we all have our unique perspective, and my perspective is very, very different, being that I'm a person of refugee background, have unique struggle living in inner city, and sometimes being looked at as an outsider than an insider. And so I just want to say that when I look at this bill, I'm worried for all Minnesota, and at the same time, I also worry for our healthcare facility not being able to do intake on our most vulnerable communities, and we may miss on fully handling the containment of this COVID-19 virus here. So, but then at the same time, I'm hopeful, and that's why I'm speaking up to put this on the record so that it's here for agency and for our senator legislature to hear that if we put everything holistically and forgetting the vulnerable, then maybe we may miss some opportunity. So I just thought I want to communicate that point to everyone, and I appreciate Senator Benson for a good response. So thank you very much, Mr. President.
Further discussion on the bill. Senator Marty.
Sure, Mr. President, thank you. This is a serious crisis, and this bill is an excellent start to addressing health care concerns about it. I urge your support.
Seeing no further discussion, the Secretary will give Senate File 4334 its third reading.
Senate File number 4334, a bill for an act relating to public health.
Third reading. Final discussion on the bill. Senator Nelson.
Thank you, Mr. President. I rise in support of Senate File 4334. Just like Minnesotans all across our state, we have watched as the coronavirus COVID-19 has spread across the globe, into our country, and into our state. Minnesotans are paying attention. Minnesotans are working together to support one another, their families, their communities, and their health care providers. I'm glad that today the Minnesota Senate and Legislature have come together, the Minnesota Senate and House have come together in quick manner to get additional emergency funding out the door right away to make sure that we can test, diagnose, treat COVID-19. We believe we can slow the spread, and measures are being taken all across the state to do that. The money that we appropriate tonight will definitely help slow the spread and save lives. I do want to address one item, and that is those who have said that, well, there's only 50-some cases in this state, and are we overreacting, and are we overspending? Clearly, this is a case where an ounce of prevention is worth a pound of cure. I want to make sure that all members and Minnesotans know that if any of this, the original $50 million or the $150 million that can come out in grants as well, if any of those dollars are not spent on COVID-19 testing, treatment, and support, those dollars will return to the general fund. So members, this is an unusual, necessary, and immediate step that needs to be taken in these unusual times. And I'm glad that we are going to pass this and get this into the hands of our communities, our healthcare providers, and our people quickly. Thank you.
Final discussion on Senate File 4334. Senator Senjum.
Thank you, Mr. President. I just want to stand quickly and thank Senator Benson, I think on behalf of all of us, for her gallant effort on behalf of this cause. It's important, and I know it's a lot of hard work, and she deserves our thanks. So thank you, Senator Benson.
Members, final discussion on Senate File 4334. Senator Benson.
Well, I want to take this opportunity. We don't usually do thank yous like this till you get to the end of session, but it's felt a little bit like May today. I want to thank Eric Nauman and Katie Kavanaugh and Dennis Albrecht, Liam Monahan, and all the folks in Senate Council who just dive in and make things happen and get it right. And it matters so much. To Bailey and Larissa and Ryan, you started out this morning with a good laugh and will end this morning with a good laugh, I'm sure. I'm grateful for your work. I'm really grateful for Senator Rosen, Senator Ralph, Senator Klein, and Senator Marty, because it gave me people to bounce ideas off of who I trusted had the same motivation that I had. And so even if I was a little off, I had somebody that I could turn to. Hearing from hospitals and having Senator Klein to reach out to and say, is this making sense to you, helped me understand some of the importance of what this bill did. But mostly, I want to say thank you to our healthcare system, the people who work in it. We count on you, and we are with you, and we are grateful for you. And with that, Mr. President, I recommend that Senate File 4334 be recommended to pass.
Members, we're on Senate File 4334. Is there any final discussion? We're on final passage of Senate File 4334. Seeing no further discussion, the Secretary will take the roll. All members having voted who have the desire to vote, the Secretary will close the roll. There being 55 ayes and 0 nays, the bill is passed and its title agreed to.